Hi everyone, I am excited to have our friend back here again, and we're starting to do some extractions, and he just started on the wash, and so his first day of school is coming up, so we're trying to do as much cleaning as possible. How are you doing?
I'm good.
Awesome. Okay, making sure again that we stretch that skin, go underneath, and scoop everything out. He's got a lot of clogging underneath his skin. Even when we did his forehead, he still has a lot more for us to really clean. It's going to come up forward on the upper layers. It takes about 90 days for that bacteria to literally resurface all the way through. So we're going to be really cleaning his skin to get it cleaned out completely. And I'm just kind of feeling underneath the skin and see what's there. And as I, extract, you could see all of the oils coming out. This type of acne, which is, an acne that is non-inflammatory, but it's within the skin, the bacteria that is in there, and so it's actually harder to manage this type of acne versus one that has an inflammatory condition, because all of the pus and everything is up more towards the surface, and we can actually clear that up a lot quicker than we can this. Hard to believe, huh? So our goal is to make sure that we get coming up to the surface and we get everything extracted out. I hope everyone is doing good. It's Friday, and so I'm excited for the weekend. I've had a long week, but it's always good to come to work. I enjoy it. Again, if you could see, I'm stretching, and look at all the oils that are coming out. Okay, I'm going to go ahead and wash again. I'm going to use the 20% acid wash. just to keep those pores exfoliated. And again, I'm just really stretching underneath here and pushing on those pores. I'm gonna go on the temple here. Okay. Ready? Okay. I'm gonna go ahead and do this area here and the temple. When I extract here, I always feel like the person that's receiving the extractions feels like we're going to take your brains out. Does it feel that way?
Yeah.
I'm so sorry. I promise we're not, but really that's how it feels. It's almost like, am I going to survive this? I promise you will. Holding up okay?
Yeah.
And you will see that as he continues to come to see me, I'm going to have to go through this area again. And the reason why is because he's got still active acne growing underneath that's going to come up to the surface. Like I said, there's 90 days, about 3 months worth of things that are way underneath that to go ahead and get it up to the surface of the skin. Okay, I'm going to go ahead and move you this way. Okay, you're doing okay?
Mm-hmm.
That rhymes. Okay, as you can see, stretch and go underneath and scoop out. and stretch underneath, underneath. Again, base. Okay, you could see them in here. Right there. Right there. Make sure it's completely out. Because I could still see there's content underneath there, so I'm going to make sure that everything is cleaned out. Stretch, 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 stretch through here, again in here. Okay, let me get this one because Jotty said, and Ilsa, I could see that one, and everybody else is gonna see it. So I'm gonna go ahead and get it. So this is it. There it is. Okay, so we're gonna go back to this one. So, okay, so has lots of blackheads and okay, we're almost done in this area. Okay, everyone, I am going to cut the video short. And the reason why is because it's, it's getting too much for him. And so whenever you're doing a client or, patient, you definitely want to take that into consideration. With us here, it's not about filming. It's more about education. And first and foremost is making sure that our patients are happy and they get the results and that we really take in consideration their level of pain. So he's a little bit uncomfortable, and so we're going to go ahead and cut it quits. I'll call it quits. So anyway, thank you so much for joining us. Next time we're going to be working in this area through here, so you can see we got a lot to work on. But every time that he comes in, he's just going to get better and better. And don't forget to subscribe to our YouTube channel, follow us on Instagram, and like our Facebook page under Anilsa Skin Essentials Acne Clinic. Have a wonderful and blessed day. Just remember, I love you.